Episode 15. Side effects of Ribavirin. Are they worth the risk in long COVID? Welcome back to Ribavirin reminiscence and lingering load in long COVID 19. I'm your host Anushka, a genomics nerd with a master's degree and a heart tethered to unraveling the tangled threads of long COVID treatment. Today, we are stepping into a storm of science and ethics, wrestling with a question that feels like balancing on tightrope over a chasm. Ribavirin, a drug with decades of battle scars, carries side effects that loom like shadows. In the uncharted wilderness of long COVID, are its risks a price worth paying? Joining me is Saakshi, a brilliant mind who peers into the microscopic battlegrounds where pathogens, inflammation, and the human body collide. Saakshi, it's always a joy to have you back. Your lens on this feels like a lighthouse in the fog.
Thank you, Anushka. This conversation is like cracking open a Pandora's box. Necessary, urgent, and of course, a little daunting.
Saakshi, this virus is a trickster, isn't it? Just when we think we have pinned it down, it slips through our fingers like smoke. Let's ground ourselves with the basics. Paint us a picture. What are ribavirin's most notorious side effects?
Picture ribavirin as a double-edged sword, Anushka. It's a warrior against certain viruses, but it cuts deep into the body's own defenses. Three shadows loom largest. First, hemolytic anemia. It's like a thief draining the life blood from red cells, striking 10 to 15% of patients. It can force you to lower the dose or even abandon ship entirely. Second one is teratogenicity. This one's a sleeping dragon. In animal studies, ribavirin has caused birth defects that linger like a warning in the wind. It's forbidden during pregnancy and even months after for both men and women. And the third one, neurotoxicity. A quieter menace, but no less real. Long term use can stir up a storm in the mind, irritability, insomnia, depression, and even a fog that clouds thought. It's like the drug whispers doubts into the brain's wiring.
That's really vivid, Sakshi. It's like ribavirin is a guest who brings both medicine and chaos to the table. I'm already feeling the weight of those shadows.
And you should, Anushka. It's not a guest you invite lightly.
You mentioned this virus plays tricks, and long COVID feels like its cruelest sleight of hand. Symptoms that linger like uninvited ghosts. Why do ribavirin side effects cast such a long shadow, specifically in this context?
Exactly, Anushka. Long COVID isn't a raging fire like Lassa fever or hepatitis C cirrhosis, where you might wager everything on a risky cure. It's more like a slow, smoldering ember. Fatigue, brain fog, post exertional malaise that can burn for months or even years. Ribavirin, with its heavy artillery, might be using a sledgehammer to crack open a walnut. The stakes shift here. You are asking patients to endure weeks or months of treatment that could deepen their exhaustion with anemia or thicken their mental fog, neurotoxicity. It's like offering a weary traveler a map that might lead them to quicksand. Ethically, we have to ask, are we healing or are we adding to their burden?
That's a gut punch, Sakshi. It's like we are trying to fix a cracked vase with a hammer, hoping it doesn't shatter instead. How do we even begin to weigh that?
With eyes wide open, Anushka, we need to see the whole landscape: patient, drug, and disease before we take a single step.
Let's zoom in on that anemia shadow. It sounds like a vampire sinking its teeth into the body's vitality. How bad can this get, and how fast does it strike?
It's a swift predator. Within 1 to 2 weeks, ribavirin starts pooling in red blood cells, sparking oxidative stress that tears them apart like paper in a shredder. Hemoglobin can plummet nearly 3 to 4 gram per deciliter. Imagine your energy reserves draining like a cracked hourglass. For someone with long COVID, already dragging their feet through fatigue, this could feel like the ground dropping beneath them. Worse, even if you stop the drug, the damage lingers like a stubborn guest, taking weeks to fade. It's not just a side effect, it's a betrayal of the body's trust.
That's chilling. I'm picturing someone already struggling to climb a hill, and then this truck steals their oxygen. Is there any way to brace for that kind of hit?
You can monitor closely. Weekly blood tests, a hawk's eye on hemoglobin. But you're still rolling the dice. Some patients weather it, whereas others capsize.
Now, let's shift to teratogenicity. That sleeping dragon you mentioned. It feels like a ticking time bomb in the context of long COVID patients, many of whom are young and building their futures. How does this risk play out?
It's a minefield, Anushka. Long COVID often strikes people in their 20s to 40s, which are the prime productive years. Ribavirin demands a vow of vigilance: two forms of contraception during treatment and for 6 months after for both men and women. One misstep and the consequences could be catastrophic. Birth defects that scar a life before it begins. In trials, this narrows the path. You exclude pregnant people, those spanning families, and suddenly your study pool shrinks like a puddle in the sun. And if patients in the real world don't heed the contraception warnings, then what? Then the dragon wakes and the stakes are unthinkable.
That's really haunting. It's like asking someone to navigate a tightrope while blindfolded with their future family on the line. How do you even design a trial around that?
With ironclad protocols and relentless education. But even then, human nature is messy. People forget, they misjudge. It's a risk that hums in the background, always.
Now, the neuropsychiatric effects. This feels like stepping into a hall of mirrors, especially for long COVID patients already lost in brain fog and mood swings. How does ribavirin tangle with their minds?
It's a cruel twist. Ribavirin can stir up irritability, insomnia, depression, even, in rare cases, suicidal thoughts, especially when paired with interferon. On its own, it might weave subtler threads, a low grade cognitive haze, like trying to think through a rainstorm. Now, layer that on a long COVID patient already grappling with mental fog or sleepless nights. It's like pouring salt into an open wound. You might not be lifting up their burden. You might be piling stones on their chest, making every step heavier.
That's heartbreaking. It's as if the cure is mimicking the disease, blurring the line between health and harm. How do you even tell what's ribavirin and what's long COVID?
That's the trap. The symptoms entwine like vines, and untangling them requires patience, precision, and a willingness to listen to the patient's story.
If someone dares to walk this tightrope with ribavirin for long COVID, what kind of safety net should they demand?
A sturdy one, definitely, Anushka. At minimum, you need weekly hemoglobin checks to catch anemia before it saps their strength, pregnancy testing, and contraception counseling, relentless, clear, and repeated. Mood and cognitive tracking is another one, like a diary of the mind to spot storms brewing early. Liver and kidney function tests, since those organs are the gatekeepers of the drug's clearance. And most crucially, a clear escape hatch. If the side effects are to outweigh the benefits, you pull the plug. No hesitation. It's like knowing when to abandon a sinking ship.
That sounds like a full time job for both patient and the doctor. It's not just like taking a pill, it's signing up for high stakes mission.
Exactly. It's like a contract, not a casual handshake.
Sakshi, let's step back and face the storm head on. Bottom line, do ribavirin's risk outweigh its potential benefits for long COVID?
Anushka, with the evidence that we have today, I would say yes, they do. Ribavirin is like a lighthouse that might guide you to shore, but could just as easily wreck you on the rocks. Outside a tightly controlled clinical trial, it's a gamble I wouldn't take. If trials are the path forward, they need ironclad screening, relentless monitoring, and patients who know every twist of the road ahead. Until we have biomarkers to pinpoint who might truly benefit, ribavirin for long COVID feels like chasing a mirage in a desert, hopeful but perilous.
That's a sobering truth, Sakshi. It's like we are explorers in uncharted lands, and ribavirin is a map we can't fully trust yet.
Precisely. Long COVID patients deserve care that's a compass, not a coin toss.
Sakshi, thank you for guiding us through this storm with such clarity and heart. Your perspective is a beacon for anyone navigating these murky waters.
Thank you so much, Anushka. We owe it to long COVID patients to tread carefully, not out of fear, but out of respect for their resilience.
And to our listeners, definitely keep questioning, keep seeking, and hold tight to hope tempered with skepticism. Next time on ribavirin reminiscence and lingering load in long COVID 19, we'll dive into the debate over off label ribavirin use. Is it a spark of hope or a flicker of hype? Until then, stay curious, stay grounded, and stay well.